But thanks so much. It's just a real honor to be here with Colleen and with all of you. You are all on my list of heroes, not only for Minnesota, but for the country. And it's really fun to team up with another one of my heroes, Heather, who is one of the first class of dental therapists and really a rock star on our team at Apple Tree Dental. So today we're going to talk about the positive impact of dental therapists on organizational productivity and clinician and patient satisfaction. And a big thank you to the Minnesota Dental Therapy Association for inviting us to share some of what we're doing today. We're hoping you're going to be learning a few things, be able to describe the benefits of dental therapy for patients and the positive impacts on economics of dental practice, able to identify evidence, and we're going to see two stellar research reports that you can download and you can refer to that are chock full of information that you can share. But to understand their contributions to access to care that are grounded in reliable data from a decade of dental therapy practice, be able to more fully understand the dental therapy workforce model and gain appreciation for the contributions of dental therapists to organizational efficiency and capacity, and then be able to advocate for recognition and use of dental therapists using documented proof of the positive impacts of the new workforce on equitable access to dental services. So again, it's the two of us, myself, so Heather is first here, and Heather LUEBBEN is an advanced dental therapist, dual licensed, and playing leading roles across the lifespan at Apple Tree in pediatrics, working with our pediatric specialists and our general dentists and really leading that. She's worked in long-term care settings. We did a focus group study on that, and she's also worked in a behavioral health setting where she works with adults with cognitive and other types of disabilities and so on. And yeah, one of the first graduates. And then I'm Mike. I'm the CEO at Apple Tree Dental, and my background is in geriatric and special care dentistry. And so that's my passion along with public health dentistry. So we're going to begin by talking about employing dental therapists. And I'm going to set the stage for these studies, which took place for Apple Tree and its system of centers around Minnesota. So a little bit of background about Apple Tree, for those of you that don't know about Apple Tree. We're a nonprofit organization. We're celebrating our 38th year. So now I've crossed the barrier from being a geriatric dentist to being literally a geriatric dentist now. So our mission is really straightforward. It's to overcome barriers to oral health. And our vision is to inspire partnerships that foster healthy communities. And it's those partnerships with all sorts of levels of the community where you get that interprofessional expertise and you get that secret sauce to be able to overcome barriers that you can't do by yourself, but you can in collaboration with community partners. We've also influenced leaders in other states that have replicated aspects of our programs over the years. And so we like to think we're having a little bit of an impact around the country beyond what's going on here in Minnesota. This is a map of our 8 centers in Minnesota, and the counties are shaded in different shades of green. But even in 2020, during the pandemic, we treated patients from all but 2 of the 87 counties in Minnesota, so the reach is pretty great. And then Colleen mentioned that we have community sites ranging from Head Start centers, schools, behavioral health centers. We're in three of our 8 centers are co-located with medical primary care in hospital settings. And then we're in dozens and dozens of nursing homes and other settings, so treating patients across the lifespan. In 2021, we delivered 96,000 visits and over 34,000 individuals and $35.7 million worth of dental care. So we're pretty proud of the impact that that's having on underserved populations around the state. Our dental therapists alone in 2021 delivered 14,000 dental visits and delivered $5.7 million worth of dental care. So they're a big part of our team. So how do we deliver care? It's a little different. In contrast to private practice, our model is called community collaborative practice, and it's collaborating to deliver oral health services where people live, go to school, or receive other health and social services. And those 150 community partnering organizations have contracts with Apple Tree that are year-round, and we provide a full scope of comprehensive care throughout the year. It's proactive, it's interprofessional, and it integrates dental care into health systems. We call our clinics centers for dental health because they're the center of a hub and spoke model. One of our centers is the Mounds View Center for Dental Health. This is where Heather works and where my office is. It's located here in the Twin Cities. It's a modern center. We have lots of special facilities for people with unique needs, like these ceiling lifts that allow us to lift patients who need assistance getting in and out of wheelchairs and into the dental chair. We also have a special needs area in the clinic where we have pediatric specialists and adult and geriatric clinicians that are expert. And we have an advanced dentistry area that's like an ambulatory surgery center where we have a medical anesthesiologist, dental anesthesiologist, and a team of nurse anesthetists. And we're able to provide advanced services that would otherwise have to be provided in a hospital setting. Many of you know getting into hospitals, especially during the pandemic, is almost impossible for dental procedures. And we're on a scale to do about 800 services in this center just this year, which is kind of remarkable. So it's a hub, and you see the giant garage there. And you might wonder, why would you have a giant garage on a dental clinic? That's so our trucks can go out. We have a team of truckers that go out in the afternoon and evening and deliver mobile dental units to where they're going to be used for the day that night. In the morning, our team can set those up and provide a comprehensive range of dental services for a full day. They get to work interprofessionally with the staff, so if it's a school, they're working with teachers. If it's a behavioral health setting, they're working with behavioral health folks. If it's medical primary care, they're working with medical care. If in long-term care, they're working with CNAs and PCAs. But this is where you literally are doing interprofessional care on the same patients, getting the expertise that they have and being able to overcome barriers for yourself and your patients so that you can get the care done. Our teams at Appletree by the numbers. So we have, you can see all the folks there. I wanted to highlight the advanced dental therapists and dental therapists. So we have 9 on our team. This is all 2021. And I thought it would be fun to do a quickie slideshow of our dentists and dental therapists. So we'll and then we have 76 other folks that keep everything going and support the activities of all the clinicians. So overall, we had 218 people on our staff last year. And it really is a team. You know, it's the team that works together and overcomes barriers and so forth. I thought I'd share just one kind of quick story. We have dental therapists at all our centers and have done all kinds of different things. But I thought I would just share a little bit how we launched a new center in Little Falls, Minnesota. Little Falls is kind of right smack in the middle of the state. It's a small rural community, and we launched that program using a team, including dental therapists from the Twin Cities. And so this is where the CEO's little drone gets a little bit of use. So this was actually launched using a team from the Twin Cities, using those mobile dental offices that you saw in the nursing home photos, but setting those up inside of medical primary care, and I'll show you some pictures of that. We did that to be able to launch services immediately, and we've been able to sustain that even throughout the entire pandemic using this model. And currently the actual permanent clinic is being built as we speak and will be done in November, so we're really excited about that. But let's just take a little look. So these are all the people that were involved in launching that and supporting that over about 5 years now, believe it or not, while we raised funds, made plans, and converted that. And every year, thousands of patients have been getting served during that period. We set up in an area that was previously used for dialysis, and you can see how we were able to set this up and set up little treatment areas using our mobile offices with curtains and receive patients there. And so these were not being moved every day, they're parked there. And so these are operated 5 days a week, so it's a quick way to put up a ongoing functional clinic without all of the incredible costs of remodeling and all the infrastructure that you'd otherwise have to pay for. So we're really proud of the team there. Last year they had over 4,000 visits, 1,600 patients, and produced 1.4 million of dental care in that rural area. So that gives you kind of a quick look at AppleTree. With that, I'm going to turn it over to Heather to start talking about the 2 research studies that are the subject of today's presentation.
Good morning. Is this good? Okay. Before I get started, I just wanted to quickly thank the Minnesota Dental Therapy Association for having us and putting this event together. It's really exciting for dental therapy and for our association. So very, very cool. I am also excited to share with you guys the 2 studies that were done by the Oral Health Workforce Research Center, partnering with AppleTree Dental, and they really describe the impact of dental therapy at AppleTree. The first study was entitled The Contributions of Dental Therapists and Advanced Dental Therapists to the Dental Centers of AppleTree Dental in Minnesota. And it was a quantitative study, so it was really focusing on the numbers, the impact of our provider productivity, and access to care. And then the second study was entitled Provider and Patient Satisfaction with the Dental Therapy Workforce at AppleTree Dental. And so this was a qualitative study, and so it was really focused on people, the impact that dental therapists had on their teammates, their managers, community partners, and patients. To give you a brief overview of who the Oral Health Workforce Research Center is, they are a division of the Center for Health Workforce Studies within the School of Public Health at the University of Albany State University of New York. An interesting fact, the Center for Health Workforce Studies is one of 9 health workforce research centers in the country, and they are the only HRSA-sponsored center that has a unique focus on the oral health workforce. And so their research really assists with future health workforce planning. And we have a couple quick slides with just the shots of the researchers and authors of these studies. The research was funded, it was supported by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services as part of an award totaling $449,915, with 0% financed with non-governmental sources. Also a disclaimer, the contents of the presentation are those of the authors and do not necessarily represent the official views, nor are an endorsement by HRSA, HHS, or the U.S. government. So again, the authors, Margaret Langlier, Dr. Jean Moore, Dr. Simona Serdou, and Dr. Ellen O'Malley. And they really wanted to acknowledge the contributions of the staff at AppleTree Dental. We were obviously part of the study, but then also members of our leadership team, including Dr. Helgeson and Deb Jacoby, our policy director who's here, really helped with the data compilation and project management. The objectives of the first study, which was the quantitative study, it It was really understanding how the introduction of dental therapists has impacted the oral health service mix, quantity and quality of care, and the capacity of the delivery system. It was examining patient encounter data to describe and compare the type and quantity of services provided by our dentists before and after the introduction of dental therapists to our teams. Dr. Helgeson described Apple Tree to you guys already, and most of you, I'm sure, are familiar with our organization, but we are a large nonprofit dental organization, and we were among the first employers of dental therapists in 2012. Our patient base includes all age groups. Many of them have special healthcare needs, and the vast majority are low income and Medicaid beneficiaries. So those are just some of the reasons that the Oral Health Workforce Research Center was interested in partnering with us for these studies. And this is the link to the first study. It was published in August of 2020 in the Center for Health Workforce Studies. So the study spanned 10 years, and it was looking at data from 3 years before we had dental therapists on our team, and then the 7 years following, where we employed 15 dental therapists. This is just showing the table of contents from that study, kind of showing all the details and really how involved their study was. The methods of the study, again, it was looking at encounter data that included more than 250,000 encounters for 76,342 patients that obtained care in one of our 7 dental centers in Minnesota. And over that period, again, we had 15 dental therapists working for our organization. 10 of them were dual licensed as dental hygienists, and 5 were not. So now I will discuss the key findings from this first study. So first, looking at our dentists, the average number of patients seen by our dentist increased during the study period by 27%. And also the average daily fees generated by our dentist increased by $589. And the researchers used a 2018 standardized fee schedule that was developed by the ADA to get these numbers. They also looked at daily RVUs, which is a relative value unit. It's a common measurement that doesn't just take into account financial production, but it's looking at time, stress, mental capacity, judgment needs in order to provide a service. And the average RVUs of our dentists increased per day by 17% from the time period before we had dental therapists until the end of the study after having dental therapists for 7 years. This graphic is essentially showing what I just talked about, and it is looking to the left. You can see our dentist production and RVUs before dental therapists, and then showing that upward trend of their procedures and daily RVUs after having dental therapists. I will point out the one low area in 2016-2017, which the authors do kind of have some accountability for, and I will share that in a future slide, just so if you guys notice that. So then they also examined data from our advanced dental therapists from when they first became credentialed, which was in 2013, was when we were first, our first dental therapists were able to be credentialed and practicing as ADTs, and then the following 6 years into practice and integration into the dental team. And so they found that the average number of dental visits per day increased by 58%. And the average number of procedures completed by our advanced dental therapists increased per day by 37%. Again, using that standardized fee schedule that was developed by the ADA, they found that the average daily fees generated by our advanced dental therapists increased by $724. And then back to that dip you guys had seen in 2016 and 2017 on our dentist production, and it was noted that that same year was the highest average number of procedures per treatment day by our dental therapist. And it was able to be accounted for because of that year. Many of our dentists were in transition. They were either transferring into leadership roles or transferring between centers. And so their production was not as great as it typically was. And one of the kind of implications that the authors concluded from that is that dental therapists are able to help clinics remain productive during those periods of transition and dentist recruitment. So there are plenty of myths and misconceptions about dental therapy out there, and so this study kind of debunked a couple of them. One is that dental therapists are going to harm dentist production. And the fact is that the study showed that dentists are on average providing not only more services, but also those higher value and greater intensity services than they were in the past. And another myth is that dental therapists are not productive. And again, the study showed that the average fees for our ADTs increased per treatment day by $724 during the study period. I am going to turn it back over to Dr. Helgeson. He is going to introduce the second study that they did, and then I will return to discuss the key findings from that.
Super, thanks here, Heather. All right, we're going to talk a little bit about the people. So the second study, this is all the survey data. You're going to see a few key things coming out of this, and these are really highlights, summary highlights, that dental teams are very satisfied with the addition of dental therapists. Is anyone surprised? Just parenthetically. But it's nice to have it all documented, right? Because otherwise people say, well, we don't think they're going to be satisfied, you know, blah, blah, blah. Anyway, so that's a keeper. The expanded dental team is going to be able to provide timelier service delivery with reduced wait times, and patients will get more of their dental care needs met in one visit. Those are things that this data supports as well. Dental therapists feel they are valued members of their clinical teams. They do, and the other members of the team really value them as well. And patient satisfaction is extremely high. They're really very satisfied with all dimensions of their dental care, and you're going to see that from the patient survey. So that's kind of if you were taking home stuff, those would be the key things. But again, the objective of this qualitative study was to assess clinician as well as patient attitudes towards dental therapy within Appletree Dental. And looking at the dental workforce, looking at the attitudes across the various domains between the dentists, hygienists, other managers, other members of the team on the dental side, and then on the patient side, looking at their satisfaction with all of the different kinds of things that patients care about when they're getting any type of a health service. So you're going to see it broken into those two sections. These were cross-sectional surveys that were sent out to randomly selected workforce members and patients. And you can see all of the various details of who those were sent to. The actual surveys were based on research about surveys. They wanted to use surveys that were in wide use so they could compare the results of these surveys to other surveys that are out there. So these are some of the details about the surveys. All right, and then if you take a look at this, I want you to be able to read everything on this slide. Just kidding. You can see there were 180, this is the dental workforce part, so there were 180 dental workforce members that were participated in the survey, 30 dentists, 89 hygienists and dental assistants, 11 dental therapists, 50 managers and administrators, non-clinician folks, so quite a few folks in there. Most of them were female, about half were under 34. And 79% were white, which kind of reflects the demographics of the state as a whole. So I'm going to turn it back to Heather for all of the results.
Okay. So I'm just going to discuss the key findings from this second study. So the first survey assessed our clinician and administrative satisfaction with the dental therapist within our centers and programs. The questions included response options, and many of them used the Likert scale. So that is the scale where 1 is being you strongly disagree, up to 5 indicating that you strongly agree. So one of the questions was, how well do dental therapists fit within dental teams? And both dentists and our hygienists and assistants rated dental therapists fitting within the dental team very well to extremely well. All of the staff were also asked questions regarding the quality of dental therapists' work and their efficiency. And again, all 3 categories of our staff highly agreed that dental therapists perform high quality work and that dentists can work more effectively and efficiently when they are working with a dental therapist. Our administrative staff was asked questions about their opinion working with dental therapists. They were asked if they thought the dental therapy model was effective, if they thought that dental therapists are productive, and if they thought that dental therapists increased the flexibility of scheduling. And all of our administrators indicated very high levels of agreement to questions related to having dental therapists on their teams. Our staff was also asked if they felt that other states would benefit from the dental therapy workforce model. And again, all 3 categories of our staff strongly agreed that other states would benefit from having a dental therapy workforce model. They were also asked their opinions, several questions related to their opinions regarding improvements to patient care. And an overwhelming majority of the respondents noted reduced wait times for patients to receive the needed care. Many of our respondents also acknowledged that having dental therapists on our staff allowed the patients to have more needs met in one visit. And then they were asked several questions in regards to their opinions on the DT and the ADT required education, supervision levels, and the scope of practice. Responses from all of our staff all clustered around believing that the required education, the supervision levels, and the scopes of practice for DTs and ADTs should remain the same. Some of the things the authors noted also was that our dentist responses tended to trend a little bit higher toward believing education should increase for DTs and ADTs, which is very interesting. Also, the hygienists and assistants responses tended to trend toward believing that the supervision levels should be decreased and that the scope of practice should be increased. Next, the authors asked our dental therapists questions related to their job satisfaction. Our dental therapists highly agreed that they routinely use a variety of high-level clinical skills. And they also highly agreed that they experience professional autonomy in directing how they accomplish their clinical tasks. And then this one's pretty amazing because it means everybody gave it a 5. It means all of the dental therapists who responded to this said that they report strong agreement that they feel that they are a valued member of our clinical teams. The second survey measured patient satisfaction with their dental services. It used a convenience sample of 1,000 patients with an email address on file with our organization. Parents of children and adults who were accompanying patients were asked to fill it out on their patient's behalf. Again, they used that Likert scale, with 1 being strongly disagree, up to 5 being strongly agree. Compared to all of our active patients, the study sample had similar demographics. Most of the adult patients who responded to the survey were 35 years and older, female and white, non-Hispanic. Many respondents were treated by a dentist or a dental hygienist. And among the survey participants, dental therapists treated proportionately more child patients than adult patients. And the most common appointment type that survey respondents reported that they had were checkups, fillings, and dental emergencies. So the first group of questions revolved around communication and explaining information, so the provider's ability to explain information and the patient's level of understanding. Patients expressed agreement trending towards strong agreement for all of our different types of providers' ability to explain information and their understanding of their diagnosis, prognosis, and treatment needs. One thing the study, the authors did note is that our dental hygienists had higher ratings regarding information and communication than our dentists and dental therapists. The patients were also asked questions related to the technical competence and their satisfaction with treatment. Patients strongly agreed with statements regarding those things for all three types of our providers again. The authors reported several implications and conclusions from this study, including that dental therapy represents an innovative and effective approach to increasing access to service, and that early adoption of this new workforce in Minnesota and at Apple Tree Dental provides concrete evidence that a workforce with hybrid skills, preventive and restorative, can be successfully integrated into established oral health teams. So we wanted to review this graphic once again. This was the graphic that the Oral Health Workforce Research Center put out with their publication of the second study, and it highlights those key findings that dental teams are very satisfied with the addition of dental therapists. There are many benefits of having an expanded dental team. Dental therapists feel that they are valued members of their clinical teams. And patient satisfaction is high.